Hi, everyone. My name is Solomay Tibabu, and I'm your host for the Going Digital Behavioral Health Tech Summit. And I'm so pleased to have Cara McNulty, the president of Aetna Behavioral Health. Thanks so much for being here, Cara. Please tell us a little bit about your background.
Thanks, Solomay. It's a pleasure to be here, and I love this virtual format. I am a population health scientist by background and spent many years looking and studying specifically in communities how to reduce health disparities and what are the policy systems, environmental changes we need to make to reduce those health disparities. And one thing led to another. I ended up doing that field research for quite a long time, then ended up as a plan sponsor or at an employer leading benefits for employees and ultimately guests. It was a retailer. And then was a consultant. And lo and behold, one of the things I value is having the opportunity to come at problems from different angles. And so when I got the opportunity to join CVS Health Aetna, it was right at the time when CVS was acquiring Aetna, and think a retailer, which I'm passionate about, and an insurer working together, it's like nirvana. So I'm not a behavioral health clinician, but I am a health scientist, as I said, who really focuses on how do we remove barriers. What are the policies we need to improve? What are the systems? How do we innovate? Always keeping, human-centered design and the individual and their ecosystem at the center. So I've been with Aetna CVS Health for about 15 months, and it's fantastic work. I'm proud to be here and really excited with what we're doing in partnership with many startups and early start companies around innovation. So thanks for having me.
That's great. I'm definitely going to be asking you more about that. So right off the bat, maybe you can tell us a little bit about how Aetna is leveraging digital technologies specifically for behavioral health access.
Absolutely. So, I talked a lot about, or in the beginning, I talked about, we keep that individual at the center. And one of the things we know is that behavioral health space can be really hard to navigate. It's hard to know what you don't know. And often whether it's us or someone we love or a friend, people need access to care really quickly. So we use technology in numerous ways, whether that's using AI to help us understand who do we need to outreach to or who needs us to outreach to them, whether it's looking at how we're using screening techniques and technology to help people understand what their issue is or who they might need to see. Because, one of the things we know is that behavioral health, there's so many things across the spectrum of care, whether that is reducing stress and anxiety or leading or supporting somebody who has a chronic mental illness. And so we use technology to help people figure out not only what are they experiencing, but who might they see, and then how can they see that person? Because most people, let's face it, might not know what they're feeling as anxiety, or might know, do I need to see a psychiatrist, a psychologist, a licensed social worker? So we use technology to help figure out what you need and who you need to see. And then we also use technology to help deliver different modes of care. So whether that's like this through a Zoom platform or telephonic, or through chat or a chat bot, through texting and interacting. So we work hard to meet people where they're at in the way that they want to be met, not just assuming, okay, everybody wants to meet face to face. And in this time, that's pretty tricky. So we use technology a lot of different ways, and it's all about improving the member's outcome, that patient's outcome, because that's our goal, is to drive better health, better healthcare outcomes.
Mm-hmm. You mentioned a pretty wide array of tech versus touch. So when it comes to startups in particular, some are purely tech, some are mostly services. Do you have an opinion about what the perfect balance might be for a behavioral health startup partner?
Yeah, that's a great question, Salome. I think you have to step back to say, what are we solving for? Why are we doing what we're doing, and what are we solving for? So there's probably not, in fact, I know there's not one answer. Much of the time, the work that we do requires both tech and touch because the populations we serve are across the United States, all ages, gender, ethnicity, and people need different modes of not only engagement, but also service. So we're usually doing a balance, but we might have a partner that is really good just at that tech piece. And that's all we're asking them for. And then we're matching that up with another partner who's really good at the service piece. So it's really understanding what is it you're doing, why are you doing it, and what are you solving? So I would say it's both.
Mm-hmm. Yeah, and that's a great point about how do they fit into your existing ecosystem of others who might do a different component.
Right.
So on this thread with startups, I do talk to a lot of them, and so many of them get stuck on reimbursement. Mm-hmm. Can you help us understand what are some of the most common ways that the most successful startups are working with plans, or just really any advice about that topic?
Sure. I think that it's really important that the startup be very transparent in what their best possible outcome is in working in partnership with a plan. So it's easy to be a startup, invest a lot of time and energy, and struggle with getting reimbursed. So one, address it up front. Two, asking for a partnership in how reimbursement could work. So some startups or early start don't have the capital to invest in large pilots, let's say. So being transparent about that with the plan and saying, here's what we can do, here's what we can't. But if we were given an opportunity to, let's say, have an upfront investment, and we could do a pilot with you, and we could do some course correcting and customizing, that would be a way we could finance it. The other way is, you could do a straight, this is what we offer, and here's what we need to be reimbursed. Or you can do an ROI and VOI model, so the return on investment or value on investment. But for startups, that's pretty hard because one, usually you're starting with a small pilot, and if the return on investment, let's say it's medical cost savings, that takes time. So I really encourage startups to have this conversation and to be upfront with what they can and can't do, because it doesn't have to be one way. It doesn't have to be one specific model that's followed. But when there isn't that conversation, I often see the reimbursement problems become exacerbated because neither side has addressed the issues of, okay, wait, how are we going to know if we're successful? How are we going to get paid for what we're doing? And we all know that most startups don't have extra human capital, don't have extra financial capital. So being really clear with your partner is imperative.
Mm-hmm. That seems to be a key theme throughout the day. Is some of the most successful startups come to be because they're really co-developing with the customer. So,
right.
Besides reimbursement, could you talk more broadly about what are some of the major pitfalls when it comes to startups pitching you or Aetna?
Sure. Usually when I've seen startups do a really fantastic job, and I've seen them maybe not be their best because they haven't either we haven't done a good job explaining to them prior what we're solving for, or they haven't asked the question. And I will say it goes both ways. And so super important to have clear understanding what, before that meeting, what I or those you're presenting to are hoping to solve. Because you want to have alignment on what you're going to have a conversation about. Second, a mistake I see made is reiterating the problem over and over, or spending too much time in the beginning of the presentation on the problem. And realistically, people have maybe it's 30 or a 45-minute window, and we know the problem. We might not know some specific details. So don't spend a lot of time on the problem. Give us the specific details that you think matter to us as a business. And the last thing I would say is understand the pain points we're trying to solve. So I'll tell you one for me that is we're always trying to solve. That is looking at how do we make sure if we're going to partner with a startup that we know how that's going to fit into our ecosystem. We know how that is going to advance the outcomes we're driving, which is access to care, quality service, meeting that member where they're at on their journey, facing a member or looking at a member holistically. Know my pain points, because what I can't have is a bifurcated, disjointed member experience. So knowing what I'm solving, knowing what you can do and can't do, and then not spending too much time on the general problem.
Mm-hmm. Yep, that makes a lot of sense. Now that we're on this topic of launching pilots, something that's come up with many startups is asking to have access to claims data and other information so that they can start building a case for ROI or whatever it might be. What do you think about all that?
Yeah, it's a great question, Salome. I would say that there's so much risk for us to just say, here's access to our claims. Mm-hmm. And it's not necessary. Because if you look at the population at large, there are clear indicators and there are other, data sets that can be used that show the risks, the opportunities, the disparities of a population. So the startup could give an example and use a data set that isn't ours, but saying, in community A, these were the biggest issues. This was the general demographic. We don't have to see it exactly on our population. Show us how you would use the data. Show us how you would calculate the data. Show us how you would calculate ROI. Get us comfortable before we get to a place where we're giving you access to a data feed. I say it's like, show me the sandbox and what's in your sandbox and how you're going to play before I say, okay, bring in all your sand. Mm-hmm. It doesn't have to be our exact population, because there's many ways to mimic a population. And that also helps employers and plans feel, I would say, more secure, because you're seeing how they're working with the data before actually giving the data. And it just takes the risk out of it. It also moves a pilot along, a pilot proposal a lot faster. Because if I'm going to give you access to our data, it's going to, even to have you show me what you do, it's going to take us time, because we're going to go through a lot of legal issues in order for that to happen.
How do you view integrating behavioral health with physical care?
Great question. So again, I talked earlier about not asking people to guess or not making people figure this out on their own. And what we know about mental health well-being is that we have a lot of moments in our lives that something physical happens, that we know there is going to be an emotional or a mental sidecar. And so instead of waiting for that, let's serve those up together. So an example, we don't have to wait for someone to have a cancer diagnosis to know that they might have some mental health disruption. So looking at the person holistically, in the fact that if we're delivering a cancer diagnosis, or there's somebody is diagnosed, making sure that we're offering mental and behavioral health support right along with that care plan. Same for a chronic condition. Same for parents and caregivers who are having a baby or adopting a child. Doesn't mean it's going to happen, but support is going to be needed. So instead of waiting for people to say, gosh, I'm really struggling, this diagnosis, or boy, having a baby, this is hard, I'm not sleeping. Let's serve it up together and not pull these apart. Because most people don't wake up and say, gosh, today I'm going to focus on my physical health. And tomorrow I'll focus on my mental health. We are beings that are connected. So not bifurcating someone's health, and also making sure that we're really cognizant that these are normal things that happen. So I have 2 children. I had a first baby, totally fine. Second baby, I had really severe postpartum anxiety. I didn't have any conversation with my provider about postpartum anxiety, and I'm in this field. And so now if you look at the work of our maternity support offerings, and I wasn't an Aetna member at the time, you'll see that we're addressing emotional and behavioral health right along with what it means to have a baby. Let's not make people guess. Let's not make people climb barriers to get the care they need. So always thinking about those moments. How can we help people in times of transition, in times of change, in times of stress? Is super, super important.
Health plans have their internal programs, and then there are all these external startups. Do you think that, are there certain things that you think will continue to stay in-house or external over time?
Yeah, that's interesting. I think what we know is that as we evolve and as we look at solving healthcare issues and access to care and addressing people holistically, we have to think differently about what we think would be, well, that's always been an internal operations piece, so it's going to stay internal, or that's always been something external, and really being open to possibility, especially as we look at how the world is changing, how people want to receive care, how people want to receive information, and looking at what is it that we do best, and how do we make sure that's still what we do best, and then how do we partner with people who might do it better. So I can see those roles changing. I think the important point is to be open to possibility and to say, okay, how are we going to assess what's our sweet spot, but where we need additional support and help. And so I think everything's up for review and consideration, because we're changing as a society. And part of the reason I believe that the behavioral healthcare system is farther behind in meeting the needs and providing the access to care for our communities is because we haven't looked at the system in totality to say, hey, where do we need to refresh, or how might we think about this differently, or what is this policy doing that maybe has an impact that we didn't expect? So I would say that it's pretty open on how we look at who does what.
Mm-hmm. Yeah, as long as it's whatever combination to make it best for the members.
Right,
So,
right.
So something I've been excited to ask you about is, what are new opportunities in the market that you wish more innovators could specifically focus their energy on?
Gosh, I love that question. So I do not think we have done a good job in removing barriers to care. And we talk a lot about having lack of providers or, other barriers. What I would love to see us do is remember at the center is a human who needs help. And so, how do we take some of those big pieces out of the way? Like, most people don't know if somebody's in or out of network. How could we think about that differently? Most people don't know who they should see and what's the actual thing they should see them for. So how do we help people continue to be open and, access care differently? So maybe, virtual screenings or new technologies that help us identify things that are tripping us up. How do we think about, new modalities of care and ways to treat, we'll say, mild to severe mental well-being issues? There's so much here to be done. I would also say the other thing that I am hopeful there will be the continued investment in is looking at how do we use predictive analytics to help people before they're in crisis. We're a really smart society. We have a lot of really thoughtful innovators, and let's harness that horsepower and use it so we don't have to focus after a crisis. We're looking at the signs before, so we get people that care they need and how they need it and when they need it.
That's great. Yes. I only wish we could have like a couple more hours. This was so incredibly helpful. Cara, thank you so much for taking the time for sharing these great insights with our audience today.
Oh, my absolute pleasure. Thank you, and be well.